What if everything you thought you knew about healing was only part of the story? What if the real key wasn't just in your labs, your diagnosis, or your prescriptions? Today, we're talking to a top California functional health doctor who says your body already has the power to heal itself. You just need the right tools to jumpstart your health journey.
From the Stream Center, welcome to Bloom Health Club, sponsored by Monticello Family and Sedation Dentistry.
Welcome to Bloom Health Club. I am your host, Gayle Guyardo. Today we're talking to top California functional integrative medicine doctor, K McCann, who looks at medicine through a different lens. And that is why she has the power to heal thousands of people. And she is joining us now. Thank you so much for being here, Dr. McCann.
Thank you for having me, Gayle.
And Dr. McCann, I wanted to introduce you to my producer, Nacha Castillo. She's going to be behind the scenes kind of punching the show for us today, but she might jump in throughout the next 30 minutes asking a few questions of herself. But let's get started with what is a incredible problem in this country, and that is the rate of chronic illnesses. And it goes to show that your way of looking at medicine needs to happen more broadly, because whatever we're doing now just isn't working.
It's true. There is a tsunami of chronic illness that's coming. And unless we really reframe and rethink the way that we are managing it, it's just going to explode and overwhelm all facets of society. The rates of autism are increasing. The rates of autoimmune disease are increasing. I see patients with complex chronic illness all the time, long COVID and other chronic infections. And the way that conventional medicine looks at things is really not the answer anymore. It's great at acute illnesses and not so great at complex chronic illnesses.
Yeah, we talk about it all the time. Listen, if you need heart surgery, a knee replacement, I mean, the advancements of medicine and the way our system handles that is incredible. But the everyday person, including myself, has found themselves lost in the system. So talk to me about the way that you crack the code for so many of your patients who were left almost confused and tired of searching for answers because they got nowhere.
Right. I think one of the aha moments that I think is really important is to understand the framework of conventional medicine. So for me, when I realized that we did not ask why, we did not ask why is this person, what's unique about them? Why are they getting ill? In conventional medicine, we ask, what are the symptoms? What is the possible diagnosis? And then how do we differentiate and figure that out? But we're never looking at the genetics, the epigenetics, the lifestyle, the diet, the root causes. What functional medicine is much better at looking for.
And I just wanted to ask, because you mentioned symptoms, and so quickly doctors are writing prescriptions to mask the symptoms, but actually you say symptoms are not the enemy. In many cases, symptoms are the answers, and these are the clues that help you heal patients.
Absolutely. Again, conventional medicine sets the world up as the body is against us. If I'm fatigued then my body is against me. My will wants to do one thing, my body is doing something else. And really, if we reframe the way that we're thinking about our symptoms and we ask, what is this here to show me? Have a curiosity rather than a need to control, then it opens up the world of possibilities for us to start to inquire. Is there a way that I could listen a little bit differently? Is there something that this symptom is trying to teach me or communicate to me? And, I think about our body and our intuition a little bit like a toddler. When a toddler is trying to get our attention, they're, tugging on the pants, or tugging at us saying, hey, mommy, daddy, pay attention to me. And what we're doing when our immune systems, our intuition, our bodies are trying to communicate to us is we're saying, shut up, kid. I don't want to listen to you. I'm going to muster through. I'm going to power through. I'm going to, do whatever I need to do. Where would we ever treat our toddler that way?
No,
Of course not,
we would
right?
not. So, what do you do differently than most medical professionals out there?
Offer that reframe, I think. It's very simple to say, okay, you're having all these symptoms, but what if the symptoms are not the enemy? What if the symptoms are a message? And we can decode that message and start to be more loving and be more open to the possibilities. And I have a few examples that start to make this easier for people to understand.
Yeah, there's an instance where a 62-year-old patient came to you and she was dealing with thyroid cancer. How were you able to help her?
So I asked a little bit more about her life and what was going on and what was happening to her around the time that the thyroid cancer developed. And it turned out that she was in this very challenging business partnership with another woman who stole a whole bunch of money from her, stole clients from her, and left her with a mountain of debt in their shared business. Um, and she grew up in a family where it was not okay to say, hey, you're doing me wrong, and we need to really work this out. She just kept closing off her voice, not saying anything, and allowing this woman to treat her like a doormat. And her body was sending her messages saying, hey, how you're being in the world, how you're letting people walk all over you is not good for you. It's not good for your health. It's not good for your body. It's not good for your being and what you're here to do on the planet. And it's showing up right here. So I asked her, what are the other organs in the body that are right here? Is it the esophagus? Is it the windpipe? No, it's the voice box, right? And how is it, let's say her name's Joan. How is it, Joan, that you might not be using your voice? You might not be really in alignment with how you need to be and how you need to speak up for yourself. And for her, this was a big aha moment like, oh, yeah, you're right. When we are not truthful with ourselves, when we're hiding from ourselves, it's very, very exhausting
Yeah.
to be living a lie.
It is. It is. And there was that popular book, The Body Keeps the Score. And I think a lot of people, especially women, do not realize that, if we keep taking these things on, one way or another, the stress will manifest itself in different diseases, including cancer. And there was another really interesting story that you talked about, that a woman in her 50s came in with her kidney failure. And this is a prime example of how you don't just look at the patient and their labs, but you get to know their history. And it linked back to an exposure level, which I thought was really fascinating because my father, my whole family, they were in the dairy business and had exposure to chemicals. And all of a sudden, my dad had a certain type of cancer that it was directly linked to that. So you going to get the entire story is a really important part of your practice.
Yes, it is. That patient was, on the surface, a perfect patient. She ate well, she took all of her supplements, she exercised on a regular basis. She was really committed to her health. And so it was shocking to me when I looked at her kidney function to recognize, that's not normal. So a normal kidney function is a glomerular filtration rate, or eGFR. It should be over 90. For her, it was like 62. And it doesn't get flagged by conventional medicine until it's less than 60. But for a 50-year-old to have a kidney function of in the 60s is not normal. And so did a deeper dive, talked to her about her family, where she grew up, and I figured out that it was a toxic metal called cadmium that she had been exposed to growing up on a farm in the Midwest. And that cadmium was causing her kidneys to fail prematurely. And then on top of that, we subsequently found that she had 90% blockage I'm sorry, her coronary calcium score was at a 90%, meaning she had calcification in her blood vessels in her heart of somebody who was much, much older, 90% for her age, which is catastrophic for a woman who is clearly trying to do all the things right, correct? Um, and as it turned out, um, she had been abused by one of her older brothers.
Mm.
And so that really hardened her heart. She
Yeah.
had to close that part of herself off. And since we figured these things out, she did chelation to remove the cadmium. She did a bunch of other IVs to work on the calcification. And she did a lot of internal personal work, and is now like happily with a partner. And it's a good, healthy relationship for the first time in her life. Um, and her heart is more open. And so many of the other things in her life and her health have really improved because we're not only dealing with the metals and the toxic exposures, but looking at her as a whole person.
I think that's so incredible. I want to switch gears just a little bit, Dr. McCann, and talk about something that a lot of health experts, including yourself, believe, and that is plastics are the new smoking. I mean, and the sad part about plastics is that like a cigarette you might choose to pick it up, but we're getting plastics thrown at us and not just in water bottles.
Right. Yeah, they're everywhere. Plastic is everywhere when you start to really pay attention to the exposure that we have. And not only that, it's places that we don't think about. So yeah, the plastic water bottles, of course, are everywhere. Um, but there are several other chemicals that can be involved. But first, I'll talk about plastic. So think about all your personal care products. Think about the food that you buy that's wrapped in plastic. A lot of those like frozen microwavable vegetables. It looks like a great idea. You can just throw the bag in the microwave and microwave that, and then you're eating your organic frozen vegetables that have just been steeped in plastic. Oh my goodness. Um, our polyvinyl flooring, our yoga clothes, and all the polyester in our clothing. Every time we wash that clothing, every time we dry that clothing, all the plastic gets in the dust in the house. Think about all of the plastic toys, our computers, our TVs, the polyvinyl windows. I mean, it's endless. There is certain kinds of chemical plastics that we also know about that are problematic, such as bisphenol. So most people have heard about BPA free. Well, it turns out that BPS and BPF, which are the substitutes, are just as toxic as the BPA. So really needing to avoid those bisphenols in the harder plastics. So your baby water bottles, any sort of personal water bottle. BPA is also found on receipt paper. It's in the lining of cans. So any sort of canned food, canned drink is going to have the bisphenols in there too, which is hugely problematic. Is your mind starting to explode
Yes,
yet?
because I'm like, what do I eat? What do I wear? What do I do to stop the toxin exposures?
Yeah, it is tricky and it can get overwhelming, and that's not my goal. My goal is to educate and empower you to make healthier choices, and for all of your listeners too, right? I'm not perfect either, but I can't, carry my glass water bottle with me. If I know I'm going to eat out, I try and have a little to-go utensils made out of bamboo. I don't. I'm still transitioning over from my yoga clothes
Yeah, that's
to,
an expensive
to
transition.
it's an expensive
Yeah.
transition, yeah. But there are clothes out there that are non-toxic, organic, or I found this great company that makes yoga clothes that are not made from plastic. And then we just do the best that we can. Other things that we can do, dust and vacuum frequently, actually. It sounds kind of crazy, but so much of the plastic debris, the microplastics and the nanoplastics are in our dust. And so we can even just dust in our homes.
And you're seeing this wreak havoc on our health, this plastic exposure. I mean, is it fair to say that it's linked to thyroid issues, hormonal imbalances, all kinds of things? I mean, I just saw a huge article, and we had a top pediatrician, holistic pediatrician here in the Tampa Bay area, link it to autism.
Yes, it's linked to neurodevelopmental disorders. It's linked to neurodegenerative disorders. These microplastics and nanoplastics, especially, can go into the brain. They can go into the testes and the ovaries and disrupt our hormone function as well as our metabolic function. Many of these chemicals and the plastics, like the bisphenols and the phthalates, these are all known, what we call obesogens, or you know, chemicals that cause obesity, chemicals that cause metabolic dysfunction. We're finding plastics in the arterial sclerosis in blood vessels for coronary artery disease as well. So it gets everywhere. And the more that we can do to avoid, it's really important, because there aren't good ways to get plastics out of the body other than plasmapheresis at this point, which is very expensive modality where you just exchange your blood.
Wow, that that sounds expensive and
It's
maybe
very,
a little bit painful. Nacha, do you
yeah.
have any questions for Dr. McCann?
Yeah, talking about how overexposed we are to microplastics and the nanoplastics. Have there been any links, any studies that link this to even mental health conditions as well, like brain fog, or people that are suffering from a cognitive decline, anything like that?
Yeah, there are definitely studies that have linked plastics, microplastics, and nanoplastics to brain inflammation. And, brain inflammation is really what's going on when you have mental health issues, when you have brain fog, um, depression, anxiety, and then certainly the cognitive decline. So, yeah, it's not going to be the only thing. I mean, I think that that is one of the bigger messages, is that it's not just about plastics, it's a total load problem. And many of these plastics are combined with other chemicals like flame retardants, which are forever chemicals, and toxic metals, which have their impacts on the body as well. So we have medical literature to support these issues in many different areas and many different conditions.
Good to know. Good to know. We like to jump in with some viewer questions from time
Sure.
to time and kind of ask the experts. So we're going to start with the first one that comes from Jessica. And she wants to know, is there a way to find out why I keep having headaches? Are there ways to relieve the pain?
Yes, Jessica, unfortunately, you're not alone. Lots of people have headaches. And, a couple things that I think about that are easy to start with are you eating something that might be worsening your headache? Sometimes people are sensitive to gluten or to dairy. And so those are things you can do an elimination diet to see if your headaches improve. I also sometimes we'll see headaches around menstrual cycles, and so looking for patterns in your monthly cycles with your headaches can be important. There are um, you know other things that can be driving headaches, such as environmental toxins, like we've been talking about. Mold can be a big driver. But I would mostly think about those things if you have something else going on. So if there's an autoimmune condition, if there's other symptoms, sometimes headaches can be allergies. So, looking really at the patterns of your headaches is one of the first ways to start to identify what could be driving them. And then in terms of supplements or things that you can do, um, anything that's going to bring down inflammation. So I find that fish oils can be very helpful. So these are your omega-3 fatty acids. Magnesium is exceptional at helping with headaches. B2 riboflavin is also necessary for headaches. So really making sure that you're eating a healthy diet and that you're avoiding anything that you might be sensitive to and adding a few key supplements.
All right, let's go to the next question, which actually comes from Tom, but you hear this a lot coming from women as well. Is it normal to feel tired and fatigued all of the time?
No, Tom, it's not. It is one of the most common complaints I get in my practice on the regular, unfortunately. So when we're fatigued, our body is sending us a signal that the mitochondria are not working properly. And there can be so many different causes for fatigue. You know, so we want to rule out the big possibilities, make sure that your thyroid works properly, make sure that you have adequate nutrients, make sure that you're not anemic. For a man, I also look at their testosterone levels. Low testosterone levels in men is associated with environmental toxins and plastic exposure, and can certainly make a man feel really fatigued and have lack of motivation, be depressed. Chronic infections, mold. It's really helpful to work with a functional medicine practitioner who can ask those deeper questions as to what's going on. You know, so we start with the most likely suspects and then we move on. And then you know, there is something called the cell danger response, which was developed as a theory by Robert Navio, PhD. And what he's talking about is when the cell feels threatened, it will shut itself down. And essentially that turns all of the metabolism down in the body and manifests as fatigue. And so, you know, kind of using the techniques that we talked about earlier is like, what is the body trying to say in making you fatigued, right? Is there some way that it might be serving you? Is there some way that it might be helping support you? Is there some other way that you can listen? Is there a possibility of a reframe of what that fatigue means? Maybe you're not speaking your truth. Maybe you're not living the life that you really want to live. Maybe you're feeling depressed or trapped in the situation that your life has, where you are in your life, and there's a way to use that symptom as a guide to look inside to figure out what it is that you do want in your life.
I love that you circle in, you know, the circumstances that we're living in, because I think people don't realize what a huge role it plays in our healing, in addition to looking at labs and digging and deeper. Now, Dr. McCann, do we have to be in California to access you? How do folks find you?
Fortunately, I am licensed in about 12 other states. So if you are in a state where I'm licensed, you can come see me. I do ask people to come to California the first time, and then we can do telehealth and then annual in-person visits after that.
Okay.
That's for insurance purposes, requirements. So yeah, you can actually become a patient at the Spring Center.
Awesome. Awesome. That's
Yeah.
so good to hear. All right,
And I'm
listen.
licensed in Florida too. So
Good to know, all our Sunshine State folks. Hey, I want to take a quick moment to thank Monticello Family and Sedation Dentistry, our sponsor, for believing in Bloom Health Club so we can bring experts like Dr. McCann to our show. And of course, tell all of your friends about Bloom Health Club. You can watch our streaming show, Bloom Health Club, on Apple TV, Fire TV, Roku, Samsung TV, WFLA.com, and YouTube, Spotify, and Apple Podcast. We will see you next week on Bloom Health Club.